Good morning, and thank you for joining us today for Webinar Wednesday. For those of you who are not familiar with me, I'm Ashanti Jefferson. I manage the wellness team here at the Health Plan, and we also have a guest presenter with us, Ms. Cassandra Smith from our Population Health team. Our topic for the day is going to be prostate cancer awareness, as September is Prostate Cancer Awareness Month. And I will hand over to Cassandra to get started. For those of you who may be new to joining us, we encourage you to engage. At the bottom right corner of your screen, you will see a little chat bubble. We encourage you to utilize that for any questions that you may have. Additionally, we do have reactions down at the bottom, so claps, thumbs up, any of those. We really want to make sure that we keep you guys engaged and that we're able to support any questions that you may have. So I will hand over to Cassandra. Thank you for joining us.
Thank you, Ashanti. Good morning, everyone. My name is Cassandra Smith, and as Ashanti said, I am one of the provider educators for Baylor Scott & White's Population Health Team. And today we're going to be presenting some valuable information regarding prostate cancer, as Ashanti said, because September is Prostate Cancer Awareness Month. Some of the basics that we will be going over in this presentation for the agenda will be to talk about the basics of prostate cancer. Also some of the common symptoms for prostate cancer, screening and diagnosis, some of the risk factors, and treatment for prostate cancer. So as we talked about, we're going to move into now to discuss some of the cancer basics. And just for general information, the prostate is a part of the male reproductive system. Prostate cancer is a disease in which cells in the prostate grow out of control. So September being Prostate Cancer Awareness Month is a time to spread knowledge while also providing support to those that may be affected. It is estimated that about 288,300 men will be newly diagnosed with prostate cancer this year, and around 34,700 men will not survive. This is the most deaths from cancer in men after lung cancer, and this information is provided by the American Urological Association, or the AUA. Of the symptoms of prostate cancer, we're going to go over, and it's well worth noting that different people have different symptoms for prostate cancer. Most men do not have symptoms at all, but some of the symptoms that have been noted are difficulty starting urination, weak or interrupted flow of urine, urinating often, especially at night, trouble emptying the bladder completely, blood in the urine or semen, pain in the back, hips, or pelvis that doesn't go away, and painful ejaculation. If you or anyone that you know has any of these symptoms, it is best to be sure to see your doctor right away. In discussing screening for prostate cancer, there are two commonly used tests for screening. One is a blood test, the prostate-specific antigen, or the PSA test. The other is a digital rectal examination, or a DRE test. The goal of screening for prostate cancer is to find cancers that may be at high risk of spreading if not treated, and find them early before any cancer cells spread. If you are thinking about being screened, learn about the possible benefits and harms of screening, diagnosis, and treatment, and talk to your doctor about personal risk. There is no standard test to screen for prostate cancer, but the two that we mentioned just before are the two most commonly used. The PSA tests, or the prostate-specific antigen test, measure the level of PSA in the blood. PSA is a substance made by the prostate. The levels of PSA in the blood can be higher in men who have prostate cancer. The PSA level may also be elevated in other conditions as well. The DRE, or the digital rectal examination, this is where your healthcare provider will insert a gloved, lubricated finger into the man's rectum to feel the prostate for abnormalities such as cancer. However, this test is not usually recommended due to the lack of evidence or benefits. Diagnosing prostate cancer. A biopsy is the main tool for diagnosing prostate cancer. And a biopsy is when a small piece of tissue is removed from the prostate and looked at under a microscope to see if there are cancer cells. A Gleason grade group is determined when the biopsy tissue is looked at under the microscope. If there is cancer, the grade indicates how likely it is to spread. The grade group ranges from 1 to 5. The lower the grade group, the less likely it is the cancer will spread. A biopsy is the main tool for diagnosing prostate cancer, but a doctor can use other tools as well. And some of those could be maybe an MRI. They may use an MRI to look at or to probe the size of the cells and using ultrasound waves. There's also staging. Staging, if prostate cancer is diagnosed, other tests can be done to find out if the cancer cells have spread within the prostate or other parts of the body. This process is called staging. Whether the cancer is only in the prostate or has spread outside the prostate determines your stage of prostate cancer. This information comes from the Centers for Disease Control. There are several risk factors for prostate cancer. The most common risk factor is age, but we also have gender, we also have race and ethnicity, as well as family history. Out of every 100 American men, about 13 will get prostate cancer. 2 to 3 will die. And again, the most common risk factor is age. The older a man is, the greater chance of getting prostate cancer. But family history also plays a role. African American men are more likely to get prostate cancer than other men. They are also more likely or twice as likely to die from prostate cancer. African American men also get prostate cancer at a younger age and tend to have more advanced disease when it is found. Family history, as we mentioned, can also play a role in prostate cancer if there is a genetic risk factor. For some men, genetic factors may put them at higher risk of prostate cancer. You may have an increased risk of getting a type of cancer caused by genetic characteristics that are inherited. You have a first degree, if you have a first degree relative, such as a father, a son, or a brother who has prostate cancer, including relatives in 3 generations on your mother or father's side of the family. If you are diagnosed with prostate cancer when you are 55 years or younger, if you were diagnosed with prostate cancer and other members of your family have been diagnosed with other cancers such as breast, ovarian, or pancreatic cancers. Treatment for prostate cancer. Different types of treatment are available for prostate cancer. That is something that you and your doctor will decide which one is right for you. Some of the treatment options are, one is active surveillance. This is where the patient is closely monitored and the cancer, they closely monitor the cancer through PSA tests and prostate biopsies regularly, and treating the cancer only if it grows or causes symptoms. There is also watchful waiting. This is where no tests are done. Your doctor treats symptoms when they develop. This is usually recommended for men who are not expected to live more than 10 years. Surgery is also an option. A prostatectomy is an operation where doctors remove the prostate as well as the seminal vesicles. And these are the glands that produce the fluid that will turn into semen. There are also other treatments such as radiation therapy, cryotherapy, chemotherapy. There's biological therapy that works with the body's immune system, high intensity focused ultrasound, hormone therapy, targeted therapy. And for more information on these and other types of therapies, you can visit the National Cancer Center's website.
You may have asked yourself, should I get screened for prostate cancer? The answer is, talk with your doctor. Learn what's involved. Then decide if prostate cancer testing is right for you. In 2018, the United States Preventive Services Task Force, a group of health experts, concluded that men 55 to 69 benefit most from a prostate cancer screening test. The main test for prostate cancer measures blood levels for prostate-specific antigen, or PSA. A higher than normal PSA level does not mean you have prostate cancer. PSA levels could be high for other reasons, like an enlarged prostate, prostate infection, or taking certain medicines. Your doctor may ask you to repeat the test or recommend a biopsy, taking a tiny sample of prostate tissue to send to the lab to check for cancer. Before you get tested, ask your doctor about the possible benefits and harms of PSA testing. Benefits include knowing your PSA level, which can help your doctor determine your chance of having prostate cancer. Also, finding prostate cancer early may make treatment easier. However, the test can have negative consequences as well. Because PSA levels are sometimes high when cancer isn't present, the test may give a false positive result, which can cause unnecessary worry and additional tests. Furthermore, PSA testing can't always tell which prostate cancers are deadly and which ones won't cause problems. Most prostate cancers grow slowly, so treatment may not be needed right away and might do more harm than good. Your doctor may recommend active surveillance, which includes regular checkups and tests to see if the cancer grows, then treat it if it does. Prostate cancer treatment, however, can cause serious side effects like impotence and loss of bladder control. Learn more about PSA screening and prostate cancer at cdc.gov/cancer/prostate.
That was a very informative video. Thank you, Ashante, for sharing that with us. The next slide, we want to talk about resources. So we're including a QR code. This is a patient information page, and you can scan that QR code for more information. One of the things that we want to make note of is that there are ways to prevent cancer. The HBV and HPV vaccines, because we know that viruses can cause cancer, are maybe not ways to prevent cancer, but ways to lower the risk factors for cancer, I should say. So again, those are the getting the HBV and HPV vaccines, because we do know that viruses can cause cancer. Also, avoiding smoking and other carcinogens. And the HPV vaccines, they're not just for women. Vaccination can prevent various HPV-related cancers, even prostate. And there are some links to more information on that as well. So some of the takeaways from today's presentation is that we know that all men are at risk for prostate cancer. And the most common risk factor is age. Different people have different symptoms, and most men do not have symptoms at all. The decision to screen for prostate cancer should be an individual one, something that you decide between yourself and your doctor. different treatments are available for prostate cancer.
Thank you, Cassandra, and I appreciate you sharing this information. Um, for those of you who are familiar with us, this part of our webinars, we encourage you to download the MyBSW Health app so that you can manage your care. As we're talking about screenings and appointments and things of that nature, it is very helpful to utilize the app to find a practitioner if you don't already have a medical home, to schedule those appointments for screenings, and you'll also get reminders for them as they become age appropriate, or if you are at an increased risk and maybe need to get it at a different scheduled time. So take advantage of the app. It really, really helps you to track and manage your care. Additionally, when you receive results back, you'll be able to communicate with your care team to see if you have any additional follow-up that they want you to do, or if they just want you to continue on your regular schedule. I appreciate everyone for joining us today. We will have our next iteration next month, and our topic will be breast cancer awareness, as October's Breast Cancer Awareness Month.